Hi, this is Across Borders again, and my name is Angela Ochu-Baiye. I hope you're all doing great, you're doing fine. Today I'm going to be having another conversation with a very special guest in the studio. Our conversation will be centered conditions needing similar attentions or attention rather as COVID-19. I mean, for someone like me, I've been involved with blood donation advocacy or access to clean water or mental health in general. I've always wondered since COVID-19 came in, what is happening to the other health conditions as well? And so I reached out to this amazing friend of mine who is a doctor, and I will be introducing her to you shortly, right after this, for us to have this conversation. Okay, remember that if you're watching live on Facebook and on Twitter, please click on the share button and you can post your comments and contributions, any questions that you have at any point in time directly to my guest or to myself rather, and we will respond to you during the course of the show. I'm excited to have this conversation, and we will continue with our conversation. I'll be right back. Okay, you're still watching Across Borders, and my guest in the studio is Dr. Vera Oyabure. Now, she is the CEO and founder of KarisMed Family Medicine, which is a direct primary care practice in Katy, Texas. Dr. Vera focuses on prevention and finding the root cause of diseases and not just treating the symptoms in order to help the patients truly enjoy their lives. She's coming in all the way from Texas, and I'm going to be bringing her into the studio at this point in time. Hi, Vera.
Hi. Good evening.
Oh my goodness. Can you hear me?
Yes,
Well, good evening for me. Good morning for you, right? Or, well, kind of like afternoon.
afternoon. Yeah,
Afternoon. How are you doing?
I'm doing well. It's a great day, beautiful, sun is out, no complaints.
It is sunny. Is it sunny there?
It's sunny here.
Okay, okay, that's awesome. Right. So thank you very much, Vera, for joining me today. And I'm sure we're going to have a wonderful, wonderful conversation. Now, part of my introduction that I gave, and also what I discussed with you before, was that I was always concerned, like as a medical doctor,
Mhm.
or people in the front line right now, other healthcare practitioners. I'm just wondering, what are they thinking about other conditions, other health conditions? Are they giving similar attention to it? All of
Uh,
these things have been going through, my mind, and I thought, let's have a conversation about this. But I'd like to ask you though that in your practice as a doctor, with this COVID-19 coming in right now, have you ever gone through anything like this that gave you so much hysteria, or you got so worried about, or are you even worried about it in the first place? Please go ahead.
Okay. And so thank you for this opportunity. I appreciate it. Yes,
Right.
certainly there is concern regarding COVID just because of the devastation that it's had on our world, not just our communities, but our world. This is probably the most um, how do I say it? The most devastating situation
Mm,
that our world has probably faced till date, I would say, just because it literally shut us down, shut the whole world down at once. Um, Not only to include
yeah.
the devastation in terms of the medical world and finding out how do we support people in such a pandemic time. So it's been interesting, certainly,
Mm.
and we certainly can't neglect that there were other health challenges at the same time. So it's definitely been interesting.
So what would you say though is the big deal about COVID-19? I know it sounds like a very silly question. It's like, Angela, what do you mean that, what is the big deal about COVID-19 for you? What is that thing about it?
So the thing with COVID-19 that makes it unique compared to other disease processes that we've experienced is that it's very contagious. Lots of people
Mm,
are susceptible to getting the infection. It's not a extremely deadly disease. We have seen people certainly recover from it, but what was what was more, I guess, significant about it was its contagion. You know, the ability to contract it from individual to individual and how
mm,
easily it was contracted, and that's why we saw the spread so quickly through our world.
mm. So, but when, of course, COVID-19 broke out and all of that, were you being, of course, the CEO of KarisMed, were you a bit worried that any other person coming into the hospital or the family practice right now, were you worried that, okay, uh, maybe they had a regular flu and you're thinking this might be something else? And what was it like for you having to be in that field? I mean, being a medical practitioner, and yet going through, this this period with COVID-19.
Well, there was certainly a heightened alertness. When individuals came in with flu-like illnesses, you had to have your antennas up to suspect that it could be COVID. And so initially, we had to really crack down. We didn't have many in-person visits. Much of the visits were telemedicine. If there was any cause for alarm in the hospital, you would have to put on the safety gear in order to prepare to see that patient. Those patients that
Mm,
came in with symptoms of flu-like illnesses with suspicion of COVID were actually isolated to a certain unit, even on the initial.
mm,
And so there was definitely a heightened alertness in regards to people that presented with those type of symptoms. Yeah.
mm. So going to now, personally feel that to some extent the media may have caused a whole lot of drama regarding COVID-19. Yes, I know that you mentioned, that it's the way you can contract it is quite easy. And so people, there was that notification everywhere, guys, you need to do this and everything. But a lot of people felt like, what's the big deal about COVID-19 on one hand, in comparison with other diseases as well? And like I mentioned, aren't there other health conditions that were always there before COVID-19 came in that should have actually taken the attention of the public or the government or whoever you want to call them,
Mhm.
that should have, taken the attention? So, for example, I look at the fact that in Nigeria, for example, you have more people, more children actually that have died as a result of not having access to clean water, like a whole lot. We also have in Nigeria that a lot of people have died from malaria, even in comparison to COVID-19. So, what is that? So for me, it's like, uh, is it that the lives of the people who died from the other diseases were not as important? I'm trying to place it next to COVID-19 right now, and I'm thinking, are we placing too much attention on something that shouldn't really be? But that's my take. Let's hear yours.
I I certainly think COVID-19 brought about an opportunity to really allow people to see what is important in regards to their greatest asset, and that is their health. It allowed us to really begin to embrace the importance of health and what that means in our lives and in our worlds. And certainly, I don't feel it was meant to I guess, make light of common illnesses such as malaria or typhoid or even
Mm,
acidic infections that one can get through ingestion of unclean water. So but I think
yeah.
rather show it shines light on the importance of health, bringing light to how health affects our world. So it made us look outside
Mm-hmm.
ourselves, because oftentimes we isolate illnesses to a particular part of the world or to a particular subgroup of people. But I think COVID kind of leveled the ground for everyone to kind of experience a health crisis together and see the
Mm-hmm.
importance of our health and how do we help one another. And brings to light this kind of opportunity and this type of program to be able to discuss. So I think although it was devastating and still is, we are definitely finally seeing, at least in the United States, it take a turn for the better. But yes, it did bring, it allowed us to shed light on our health and the importance of it.
I like the fact that you said, when COVID-19 came in, I mean, I know like in Nigeria, a lot of people were like, this disease is definitely a leveler. The rich is getting it, the poor is getting it. Everybody, in whatever sector you're in, it doesn't pick and choose. This is not about your morality. This is not about anything else as
Yeah.
opposed to so it has really hit the world in a big way, and that's why it is a pandemic as opposed to maybe an epidemic that's just in a certain area. But you being a medical doctor and also seeing should I say the rate at which people are getting better from the diseases, and also the fact that maybe the death rate is not as high as other diseases, for example. Would you, is there a way you could compare this disease to another disease um, and say this is way worse than this? Or if that particular disease was easily transmittable like COVID-19, then we would have been doomed in this whole world. I don't know if you get my question there. Okay.
Your question. So common diseases that we see in our world today, diabetes, hypertension, high cholesterol, or hyperlipidemia, certainly cause a more devastating effect on our world compared to COVID-19. These are diseases that are common across our geographic area, including Asia, Africa, Europe, United States. It certainly becomes more prevalent in areas where there is more or less access to healthcare or poor, let's say when you're eating, poor dieting is what I'm trying to
yeah.
for. And certainly these are certainly more deadly. These are the diseases that complicated situations where people did get COVID. And so where you were seeing people actually die from the disease, although there were much more that contracted the disease, there certainly weren't as many to die. And the ones that did certainly had some component of a chronic disease, whether that was diabetes or heart failure or hypertension, even cholesterol. Certainly, we're now seeing certain nutritional deficiencies that contributed to those disease states. And so it's certainly something we're going to be able to go back and look at and compare and see who truly was affected by this disease.
So should I maybe still ask you that, do you feel that COVID-19 is getting the attention that it needs to get right now, and there's no other kind of disease that should be getting that same attention? What's your take?
Yeah, there's certainly disease processes like the ones I've discussed previously that are certainly important and are causing a more devastating effect on people's health than COVID-19 probably ever would. That is certainly true. It's just that COVID-19 was something that, again, was quickly, it was very contagious. And so people contract the disease very easily, and it did spread through an entire world. And so it affected everyone at once,
Yeah.
as opposed to these disease processes affect people at different stages, different times in their life. Although they're very common, it affects at different times of the life. It's not going to affect everybody.
Fair enough.
And so that's why COVID is different.
Fair enough. So then that means you've just, taken away some of my fears, because at the back of my mind, probably because of what I see on social media, the TV, everybody, all we see right now is COVID-19, COVID-19, COVID-19. And I'm like, can you tell us something else? Like, can you show us something else? And so at the back of my mind, I always thought, like, even for medical practitioners like you, that all the people that might even walk into your facility, are you just thinking COVID-19, 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 or everything is going on in the normal way, like the same way you had diabetes patients coming in, and also maybe those with high blood pressure? Is this, the same? Has anything changed for you as a medical practitioner?
So your evaluation of a patient certainly has changed. The interaction has certainly changed. In Texas, we actually have to wear masks prior to seeing a patient. We have to do a screening process to make sure they don't have symptoms of COVID. If they do, we have to follow a certain protocol and procedure to take care of these patients. So it certainly has changed. A lot of medical professionals at a time weren't even able to open their offices. And so you can imagine the access of care,
Wow.
or accessibility to care, was affected by that. And so I'm grateful that I was able to manage the situation and be able to stay open and be able to see patients, but it affected a lot of people and changed the way we practice medicine, at least in the United States.
Yeah, I see. So there was this poster of some sort. I mean, different kinds of advocacy materials, went out on COVID-19, and then there was this particular poster I saw, and it basically had a list of like red zone areas, green zone areas, and places that you could easily contract the diseases. And one of the places that was in the red zone area, I hope I'm not mixing the red and green, but basically the area that you could easily contract the disease was a hospital. And I'm like, why would you put the hospital there? The hospital is supposed to be like one of the safest places, but the hospital was placed there. I'd like to ask you why you felt, or why you feel the hospital should not be placed there, or it's okay for the hospital to be placed there, before I give you my other question. Is it fair to have a hospital as the main place you can easily contract the disease?
Well, I mean, sick people are going to the hospitals, not people that are well that are going to the hospitals. So certainly you could have an increased exposure when you go to the hospital. I mean, I think that is probably accurate.
Yeah, but so if you have more sick people, sorry, going into the hospital, and the doctors are protecting themselves properly, and also making sure that the hospital is clean and safe and everything, why should we be worried about that?
So
Why I'm asking you this is because why I'm asking you this question, and I think you can link this with my next question, is because there's now a change, at least in Nigeria. There's now a change of a practice, and this is it. So previously, we had people who would be sick or ill and would not even go to the hospital, but would rather go to pharmacists to just buy drugs, right? Now there was not drugs, medication, because we tend to use drugs and medication. They would go to buy medication, right? And then there was this, advocacy that kept going on and going on, and encouraging people, you need to stop going to the pharmacist, to self-medicating and doing all of that stuff, and go straight, to the hospitals and meet with the doctors. Of course, I know that how it works in Nigeria is different from how it works in the US, but just here my question. But now because of COVID-19, no one is even going to the hospital anymore. Like if someone is ill, to even advise them to go to the hospital to see a doctor is like, no, 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 I can't go there. I'm going to contract the disease. I know of someone who lost her life as well because, I mean, she had some situation and she just didn't want to go. And it was too late and she died. So, how are we not? Yeah, so I'm done with my question. Do you see my point now?
Yes, I can certainly see where that would be a concern because of the anxiety related to COVID-19. Um, we have to be cautious though. When you need help, it's where the doctors are you want to be. If
Yeah.
that's the hospital or a clinic, you want to see someone when there is a concern regarding your health. So that's
Mm.
sad to hear that. It's really sad to hear that.
So are you saying that maybe in Texas, that you're not having that similar situations of people not wanting to come and see the doctor because they're afraid that they would contract COVID-19 in your facility or in any other facility? You're not having that situation.
So certainly there was an increased anxiety related to COVID, but here we had telemedicine available. And so that made the accessibility still be there to be able to provide care, even though
Hmm.
you didn't want to come to a specific facility. I had patients that would do that. And so that helped to protect them against the disease, but be able to still care for those other disease processes that could be going on, whether for a primary care physician, whether that was as simple as a UTI or a cold or other symptoms. I did have a patient that had cellulitis, which is infection of the skin. So things like that, they were still able to get care. It was just through telemedicine.
Okay, fantastic. Thank you. We're going to go on a very short break. And once we come back, I will ask you more questions. Stay with us. We'll be right back. Okay, I am in the studio with Dr. Vera Oyabure, and she is the CEO and founder of KarisMed Family Medicine, a direct primary care practice in Katy, Texas. And she focuses on prevention and finding the root cause of diseases and not just treating the symptoms in order to help. And as you can see, it's about health conditions needing similar attention as COVID-19. And Vera, the more we're talking about this, I'm actually thinking, maybe COVID-19 is having the attention that it needs to have. But if I were to ask you right now to give me, if you could choose three diseases that should have received the attention COVID-19 is receiving now, should have, um, what would those three diseases be and why?
So the top three I would say are diabetes, hypertension, and high cholesterol or hyperlipidemia. These disease processes oftentimes progress to things like stroke, heart attack, peripheral artery disease, where people are prone to losing their legs or amputations of their extremities. And so I would say those are the disease processes we probably should shed light on the most.
Do you think that now that COVID-19 has come in, that when we sort out, I mean, do you feel like COVID-19 has taken the attention to the point that these three diseases might probably not have that attention even after COVID-19? I mean, if you didn't have it before, why do we feel, or why do we think COVID-19 would not have overpowered it for life? What do you think?
I think it's actually helped people be more aware of health and the importance of health. I've certainly had a increase in I guess, questions regarding how they can get access to health. Some of that is because people have lost jobs, and so they're looking for options because they no longer have their insurance here. And so that's allowed them to look into direct primary care, which is the type of practice that I run. And this is, practice outside of insurance. So they're able to at least access healthcare for their daily needs this way. And so I think it's increased awareness for people to want to at least check themselves out, make sure their immune system is working properly, make sure they're not deficient of certain nutrients that we saw contributed to people that had COVID-19 and had secondary, I guess, complications related to COVID-19. I think it's helped a lot in terms of the awareness of health and your greatest asset in protecting that.
Thank you, Vera. I know for a fact that, because of the lockdown that happened, especially in Nigeria, and I'm sure all around the world as well, that a lot of people went through, anxiety and other mental health, issues, which, caused them to, I guess, look at things differently on one hand, but also, so for example, as of yesterday, I had a conversation with a psychiatrist, and we were looking at how, gender-based violence had also increased, even generally around the world, but in Nigeria as well, due to the lockdown. And now you're seeing people saying, wow, okay, I never really took mental health issues seriously, or I never really took gender-based violence seriously, but this lockdown has given me like that chance as, important as well. As a family doctor, would you say that in your practice, that you saw equally a rise in mental health issues when maybe clients came to the hospital to see you, or through even the telemed that you have? Would you say that you saw a rise in that, and how were you able to deal with it? Did you have to refer them, or how were you able to deal with it?
Yes, there was certainly a rise in mental health concerns in even individuals that I never saw have issues with depression and anxiety as related to the lockdown, develop symptoms like that. And so it was definitely a time to increase your alertness to mental health, to situations regarding marital discourse and things like that, or a situational discourse like that. And it did require that people that previously weren't needing treatment for mental illness did now need help and accommodate, whether it be therapy or actual medications. There was certainly a heightened alertness or heightened seeing those conditions now, certainly.
Okay, so here's another one. So with you being a doctor, we tend to, forget about the fact that doctors too are human beings. Doctors too have their families. Doctors too, everything that happens to us happens to you. So how are you dealing with COVID-19? How are you dealing with the, school having to, I don't know if they're at home, schooling from home or back at school, how are you dealing with it as a medical doctor, that everyone looks at you as this confident person that's fighting all the diseases? But then I also know that you are as human as every other person. How are you dealing with it?
So it's definitely been an interesting time. I've never had to homeschool my child before. So this is a unique opportunity to be able to do that. It was good. I think it increased my appreciation for teachers. I've always appreciated practice had been a valuable part of my life. So it was fun. It was interesting for sure.
Mm.
But it's allowed us to bring back what was important, family time. We got to
Mm.
go out and enjoy ourselves because there was nowhere else to go but to that we weren't in the busyness that we can oftentimes get in going to parties and attending events. We were forced to really
Yeah.
get to know each other, enjoy each other. Unfortunately, there were scenarios where people, were together so long that it did affect relationships in a negative way. But for me,
Yeah.
very much positive. Being able to,
Awesome.
as my husband was working from home and being able to work with him, being able to play with my children more, it was great. It really was. It's been a
Okay, so I guess you're one of those who are having it good, and I'm happy. I'm happy for you on that. Okay, so we're going to be wrapping up this conversation at the moment. However, I'd like to find out from you. Should we be as worried about COVID-19 if we just do the basic thing? Like if we do the basic hand washing, wearing of the masks, and all the things that we've been saying, is there any need for us to be worried? As a doctor, I think it would be nice to hear from you on giving us, I mean, tell us something that would make us feel very comfortable in doing the right thing.
So for sure, we have always known that good hygiene helps to prevent disease and
Mm.
viral spread of disease or bacterial spread of disease or any type of processes. We know that good hygiene helps that, whether that's hand washing or and making sure you're cleaning commonly used surfaces. This has always been the way you prevent disease. And so COVID-19 is really no different from that. And so we should continue that. We should continue that processing, following our local governmental officials in regards to moving forward from COVID specifically. But in general, we should always practice good hygiene, always wash your hands, always try to clean commonly used surfaces
Yeah.
to, prevent disease.
Mm. And in a way, I'm saying that maybe this could definitely be a blessing for the whole of humanity because the truth is, once you wash your hands and practice good hygiene, there are other diseases you're most likely not going to get as
Yeah.
well. And now that we've been told increase, eat healthy meals, increase your vitamin C and other kinds of vitamins to help you not contract COVID-19. The truth is, it's also going to help build your immune system against every other disease. So this is a good thing in a way, isn't
Exactly.
it?
Yes. Exactly.
Awesome. Thank you, Dr. Vera. Would you like to say any final words? Because we're going to be wrapping up the show now. Anything else that you wanted to say that you didn't get the chance to say?
Well, thank you so much for having me, Angela. It was great time. And always feel free to reach out. I'm helping people across the world, across the United States. It's an opportunity here. We have an international program that we offer as part of KarisMed and what we do here. And so please feel free, if there's any questions, reach out to @myKarisMed on Instagram or Facebook. You can go to our website. You can email us at info@karismed.com if maybe you did have a question you wanted to ask. I'm always loving to educate and be part of helping people with their health. So, yeah.
Fantastic. And maybe I should give you the chance to talk about the international package. Would you want to say that? Or,
No, they can just
yeah,
reach
please
out
go
to us.
ahead. Let us know. What does
Yeah,
that
reach
entail?
out to us. We'll be glad
Okay, then that's fine.
to. Yeah.
Okay, fantastic. Thank you, Dr. Vera, and wishing you all of the best. I hope you have fun with your family and great work that you're doing with your practice in Katy. And thank you again for joining me on this conversation. I guess we just have to keep keeping safe and making sure that we take care of our health and ourselves in general. Okay, so I'm going to let you go now.
Thank you for the
Bye.
opportunity. Have a good evening.
You too. Bye. Okay, and that was Dr. Vera Oyabure. Please feel free to check out all the social media page that she's mentioned. You can always ask direct questions to her regarding anything about your health, really. She is a family health practitioner. And we have come to the end of today's show. I appreciate everyone who's joined in right now on Facebook and on Twitter. Remember that we're going to be posting this video as well on our YouTube channel. And just search for Across Borders with Angela Ochu-Baiye. Until next week, or maybe sometime this week, I would let you know about other conversations that we're going to be having on Across Borders. But thank you very much, and God bless you. Have a wonderful, wonderful evening.